The health security of the world is threatened by the fact that there are not strong surveillance and response systems in place in these fragile settings. That's a threat to the people in those areas, and that's a threat to the world. So as the cost of doing nothing and the cost of non-intervention is not just in the areas, it is a global consequence of inaction. And we really need to look at that. Secondly, when we look at our collective goals, in terms of reaching the Sustainable Development Goals and bringing better health and social justice to the world, the fact is that the highest rates of maternal and child mortality are occurring in these same countries. We will not reach our goals on childhood mortality, on maternal mortality. We will not reach our goals on immunisation for the world unless we learn to do better in supporting these countries in conflict, in deep fragility. So therefore there is a massive cost of inaction, both on COVID but on so many other things in these countries. So we stand with Mark and the Interagency Standing Committee and our UN partners in really highlighting that the issues arising, the long-term issues arising in conflict are not only impacting the people in those areas, but have a major implication for the rest of the planet. And it is in our enlightened self-interest to address this. This is not just the right thing to do, it is the smart thing to do.
Thank you very much, Mr. Lowcock and Dr. Ryan. We now have Bayram from Anadolu, the Turkish agency. Bayram, please unmute yourself and go ahead.
Thank you so much for taking my question. We keep on hearing different reports about whether or not people can be reinfected with COVID-19 after getting the virus and then being cured. What is the WHO's current assessment of this? Thank you so much.
Thank you for the question. Yes, this is an important question that we've been asked quite a lot lately in terms of if someone can be reinfected with COVID-19. So what we understand, this is an area of active research by scientists all over the world, clinicians all over the world. What we understand from people who are infected with the SARS-CoV-2 virus, the virus that causes COVID-19, is that they will develop an immune response. They will develop antibodies, neutralizing antibodies, and an immune response that will provide some protection against reinfection. What we don't know right now is how strong that protection is and for how long that protection will last. And we need answers to those questions to be able to determine if someone can be reinfected after that immunity wears off. So this is an area of active research for the specific SARS-CoV-2 virus. We do have some answers for other coronaviruses, the MERS coronavirus and the SARS-CoV-1 coronavirus, which emerged in 2003, indicating that people have an immunity that lasts over 12 months or so and maybe even longer. And we have some results from the human coronaviruses, the common cold coronaviruses that circulate the globe regularly, and your protection lasts a lot shorter than that. So we don't have a complete answer, but it is an area of active research, and I should say an active collaborative research all over the world.
Thank you very much, Dr. Van Kerkhoff and Dr. Ryan. Now we have a question from Bianca from Globo in Brazil. Bianca, please go ahead. Unmute yourself and please go ahead.
Hi, Margaret. Can you hear me?
Very well, Bianca. Please go ahead.
Many thanks for your attention, for taking my question. Journalist from Globo News and Globo TV, Brazil. I know that Brazil is between the 63 countries that Mark Lowcock mentioned, where people need humanitarian assistance. So I would like to hear from Mark, how concerned are you, Mark, with the situation there in Brazil? And from Dr. Tedros or Dr. Ryan, if they can give us an updated general view of the challenge Brazil is facing now with more than 2 million cases. Thanks a lot.
Okay, this one's for Mr. Lowcock. So we'll go to Mr. Lowcock first, and then we've got some things to say in the room too.
Well, thank you very much. The main activity of the humanitarian agencies, which I coordinate in Brazil, relates to support for Brazil in the way they are helping people who've left Venezuela. And Brazil, like Colombia, Peru, Ecuador, a range of other countries, is taking a large burden of helping support millions of Venezuelans who, for reasons everyone's familiar with, have in recent years left their country. Now, it's probably important for me also to say that we recognize that Brazil itself has a very substantial problem. And I know that Tedros and Mike will talk about WHO's perspective on that and the support and so on. But what the humanitarian agencies do is focus their effort on the very poorest countries. So Brazil, country obviously which has developed a lot over recent decades, has typically not needed assistance from humanitarian agencies in the way, say, some African countries or some countries caught up in conflict have done. So we do not at the moment, and we hope we never need to have a strong engagement of the humanitarian agencies in dealing with the crisis in Brazil, because Brazil has built up a lot of capability of its own through the process of development. So I think that's probably what I can say on this topic, but I know that Tedros and Mike will have other things to add.
Yeah, I can make some general points. Again, the number of daily cases has stabilized between 40 and about 45,000. So we're not seeing the daily increases that we've seen possibly through the month of April and May. We saw very high rate of increase. And coming then into mid-June and into July, we see that plateau occurring. But what's not happening yet is that disease has not turned and is not heading down the mountain. So from that perspective, the numbers have stabilized, but what they haven't done is started to fall in a systematic day-by-day way. So Brazil is still in the middle of this, still very much in the middle of this fight. The last 24 hours, I think over 45,000 cases with 1,322 deaths. Overall, about 11% of cases, more than 1 in 10 cases in Brazil is a healthcare worker, which is in itself a tragedy, and Dr. Tedros referred to that similar situation in Spain. So our health workers are paying the heaviest price. The health system, the reproductive number overall, in April and May, the reproductive number was quite high. It was over 1.5 and in many cases over 2. In other words, each case was generating 2 or more other cases. That in general across all of the regions has stabilized now and is somewhere between 0.5 and 1.5 for across the different states. So the virus is not, in a sense, doubling itself in the community as quickly as it was before. So the rise in Brazil is no longer exponential. It has plateaued, but the cases and deaths continue to occur. And there is absolutely no guarantee that that will go down by itself. We've seen this in other countries. There is a plateau. There is an opportunity here now for Brazil to push the disease down, to suppress the transmission of the virus, to take control. Up to now, in many countries, including Brazil, the virus is being in charge. The virus sets the rules. We need to set the rules for the virus. And there is an opportunity, once those numbers have stabilized, to drive transmission downwards. And I think that opportunity exists now for Brazil to do that. But it is going to take a very sustained, concerted action in order for that to occur. And we wish the authorities in Brazil, we wish the frontline health workers every success in doing that. And WHO and PAHO will be with them every step of the way in doing that.
विन सिटी का अज़्म हर एक को साहिबे जायदाद बनाना। इसी इरादे से विन सिटी डेवलपर्स बार बार, लगातार और हर बार बेहतरीन और कामयाब वेंचर्स पेश करते आ रहे हैं। जहांगीर पीरा के बिल्कुल दामन में विन सिटी का एक नया वेंचर शुरू हो चुका है। 100 गज का प्लॉट 4 लाख रुपए में नकद या आसान नक्शा पर प्लॉट्स खरीदिए। तमाम बड़ी बड़ी कंपनियों से घिरा हुआ वेंचर जो आबादी के बीचों बीच है। गेटेड कम्युनिटी में क्लियर टाइटल, स्पॉट रजिस्ट्रेशन, ग्राम पंचायत अप्रूव, वाटर, इलेक्ट्रिसिटी और ट्रांसपोर्ट की सहूलत, बेंगलुरु हाईवे से बिल्कुल करीब। ओवेन सिटी डेवलपर्स अनगिनत कामयाब वेंचर्स का रिकॉर्ड रखने वाले। बुकिंग का आगाज हो चुका है, मुलाकात करें। ओवेन सिटी डेवलपर्स, चॉइस फंक्शन हॉल के बाजू, चंद्रायन गुट्टा, हैदराबाद।